The small intestine channel, point locations. SI1, on the ulnar side of the little finger, about 0.1 cun posterior to the corner of the nail. SI2, on the ulnar side distal to the 5th metacarpophalangeal joint at the junction of the red and white skin. SI3, on the ulnar side proximal to the 5th metacarpophalangeal joint at the end of the transverse crease. SI4, on the ulnar side of the palm in the depression of the base of the 5th metacarpal bone and the triquetral bone. SI5, on the dorsal aspect of the wrist in the depression between the styloid process of the ulna and the triquetral bone. SI6, when the palm faces the chest, the point is in the bony cleft of the radial side of the styloid process of the ulna. SI7, on the line joining SI5 and SI8, 5 cun above SI5. SI8, in the depression between the olecranon of the ulna and the medial epicondyle of the humerus. SI9, when the arm is abducted, the point is 1 cun above the posterior end of the axillary fold. SI10, when the arm is adducted, the point is directly above SI9 in the depression inferior to the scapular spine. SI11, at the junction of the upper and middle third of a distance between the lower border of the scapular spine and the inferior angle of the scapula. SI12, in the center of the suprascapular fossa directly above SI11. When the arm is lifted, the point is at the site of the depression. SI13, on the medial extremity of the suprascapular fossa, midway between SI10 and the spinous process of the second thoracic vertebrae. SI14, 3 cun lateral to the lower border of the spinous process of the first thoracic vertebrae, where DU13 is located. SI15, 2 cun lateral to the lower border of the spinous process of the 7th cervical vertebrae. SI16, in the lateral aspect of the neck, in the posterior border of M. sternocleidomastoideus, posterior superior to LI18. SI17, posterior to the angle of the mandible, in the depression on the anterior border of M. sternocleidomastoideus. SI18, directly below the outer canthus, in the depression on the lower border of the zygomatic bone. SI19, anterior to the tragus and posterior to the condyloid process of the mandible, in the depression formed when the mouth is open.